Good afternoon and welcome to Comcare's first Health and Safety Representative or HSR Forum. I'm Andrew Crane, Director of Education and Engagement in the Strategic Partnerships and Engagement Group at Comcare, and I'm really pleased to be joining you as host for today's forum. Firstly, on behalf of Comcare, I'd like to acknowledge traditional custodians of the lands on which we're all virtually meeting today. I'm joining you from Canberra, so I'd like to acknowledge the Ngunnawal people who are acknowledged as traditional custodians of the land that I'm grateful to be on. I'd like to pay my respect to elders past and present and acknowledge the contribution that they've made and continue to make. And I also extend respect to other Indigenous Australians and Torres Strait Islander people who are present with us today. Feel free to let us know in the chat if you are where you're dialing in from today. I'll just go through a little bit of housekeeping before we get started. The session's being recorded, which will be made available along with the presentation slides and relevant resources in the coming days. So that means you'll notice that your camera and microphone will be remaining off by default and we'll only be capturing the presenters. However, we have enabled the chat function for you to participate and engage in the conversation. Everyone here brings a different and a valuable perspective and some insights to the conversation. And we find it usually adds a lot of value to these sort of forums when participants really engage. So we ask you throughout if you can keep all the comments safe and respectful and on topic, but really encourage you to engage. We've also got a few polls that we'll have during the forum for you to participate in. That is, if your local IT settings and security controls allow for this. And you'll see one is already up there now, if you've got that functionality enabled. Keen to know how long you've been a HSR. And I can see quite a lot of you have already responded to that, which is terrific. So great to see. We can see that some of you have been in for just less than a year. We've got a real range across the 1 to 3, 3 to 5, and some of you have been a HSR for quite a long time. So yes, if you haven't responded, please do so. It's great to get some really good data in that space as well. If you are using Microsoft Teams, and currently receiving chat notifications, they can be a little distracting for some people. So there's some instructions on the screen on how to turn those off if you'd like to reduce those. The forum's also going to be discussing a range of psychosocial hazards and their impacts. So if any of the content or discussions today trigger a significant distress or it highlights the need for some support, please take action. Reach out and access that support, be that from a friend, family, peer, or professional support network. There are some links and contact numbers to nationally available support services that have just been posted in the chat. And I want to acknowledge the range of questions that were submitted by many of you during the registration. This is really helpful in helping to shape the content that we're putting forward today. And we'll look to put some of those questions to our presenters during a Q&A space later in the session. But to get us officially started, I'd like to introduce Comcare's Chief Executive Officer, Greg Vines, to give a short welcome and formally open the forum. Greg, thanks for joining us. Over to you.
Always forget that mute button. Thanks very much, Andrew, and good afternoon and welcome to all of you. It really is terrific to have so many of you joining us this afternoon. I'm in Melbourne, so I'd like to also acknowledge the Wurundjeri people of the Kulin Nations as the traditional custodians of the land that I'm on, and certainly pay my respect to their elders past and present, and also extend that respect to Aboriginal and Torres Strait Islander people who are with us today. For all of those who are attending one of our Comcare events for the first time, a very warm welcome to you all, and I hope you get a lot out of today. And for our regular attendees, welcome back. As Andrew said, thanks for all of your feedback in response to recent interactions we've had with you, and it's terrific to have you all back with us again. Today's forum is part of a series of events that we're running for National Safe Work Month, which I'm sure all of you would be aware is being celebrated this October, as it has been for the last 15 years. It's conducted by, or it's an initiative of our sister agency, Safe Work Australia, and we've been a very strong supporter of it, and particularly for its objective of promoting positive safety culture and good health and safe practices in every workplace. As part of this month and our contribution to it, we hosted our biennial psychosocial health and safety forum, and its aim is to build a greater understanding of psychosocial hazards and risk management approaches. And for those of you who may be interested in that, a recording of that forum is available on our website. And our final event for Safe Work Month will be next week, and that will be a Transport Network Forum on the 30th of October. And this recognises that transport and logistics are very strongly represented across the Comcare scheme. And so that Transport Forum is a great opportunity for industry experts and peers to share the latest information and initiatives in risk management, and as well as, of course, prevention and early intervention. But this is the first time in Safe Work Month that we've run a dedicated forum for health and safety reps, and it's really just part of the approach we're trying to take to really build stronger engagement between Comcare and HSRs, lift the status of HSRs in the workplace, and to try and ensure that we're keeping you up to date with the best practices, with the best possible information, and to also just reinforce the fact that Comcare is here to support you in your role and to provide the assistance that you need. We certainly recognise the vital role that HSRs play, and at a personal level, I've had engagement with many of you since being at Comcare, but also in my previous career, and I have a very strong personal value and commitment to the role of HSRs. And I see that you really are at the forefront of helping to prevent harm in workplaces. You identify the risks, you investigate concerns. Importantly, you speak up and represent workers, speak up for and represent workers, and you provide that essential link between employers and staff in fostering that positive and collaborative safety culture. And we do know, and the evidence shows this, that workplaces with committed HSRs are most certainly safer workplaces. So I'd like to acknowledge your own personal commitments to the health and safety in your workplace and the support you give your colleagues. And that commitment certainly demonstrated by the high number of HSRs that we've got participating in today's forum. It really is terrific to see. As I said, this increasing engagement and support for HSRs really is an extremely important focus for Comcare. We've established the HSR Working Group, which provides a mechanism for union representatives and HSRs to feed into our quarterly senior union engagement meetings that we hold across the year, which involves the main unions and the ACTU, which operate in our scheme. We also recently ran a really good networking session for HSRs at our national conference in August, and I hope that some of you were able to participate in that. And also we had record numbers of HSRs participate in that conference, and it was great, absolutely fantastic to get that perspective around the really important discussions we had back in August. Last year, we also established a formal HSR network, and for that we provide a quarterly newsletter. And this is really all around better connecting with HSRs right across our national jurisdiction to share information and resources with you. And I think really importantly, to hear from you, to hear what's happening on the ground and to hear how we can best support the work that you do. This network it's really quite amazing how it's grown. I think 12 months ago we had just a few hundred people. We're now up to over 1,400 people. So we really do want to encourage all workplaces to have HSRs, and for those HSRs to join this network. So any of those that you know, or any of those workplaces you know that haven't got representatives, please engage with them. Please encourage people to step forward and take on this role. So we've now got a program of engaging with you through just the standard communications of bulletins and updates and those sort of things, but we're also trying to promote the use of webinars, forums and other resources, just so we get that exchange of information in a really timely manner to you. Some of the examples, recent examples that we've introduced are firstly a new HSR eLearn course that's available on our website, and it introduces the role and function of HSRs under our Federal Work Health and Safety Act. While that course is not a substitute for formal HSR training, it will help anyone who's considering becoming an HSR to gain a better understanding of the role. And of course, it's also there to benefit those of you who are HSRs and those other people who work with HSRs, like managers and WHS practitioners. So it's a program that's really quite rounded out, that's full of good information. And even of those of you who have had quite some experience, I'd also encourage you to have a look at that e-learn. Earlier this year, we also revised and updated the Comcare HSR handbook. That was a major project that we undertook, and it reflects the recent amendments to our work health and safety laws, updates to the Safe Work Australia Worker Representation and Participation Guide as another example. So these handbooks help HSRs perform their functions and exercise their powers under the WHS Act, and they're really useful resource for others who need to understand the HSR roles and the obligations and powers that you have. So at Comcare, as I say, we're really committed to maintaining strong engagement with all of you and indeed broadening that engagement. We particularly want to hear from you about how we can better support you and raise the profile of your work across the jurisdiction. Today, I hope this will be the start of many of these sort of forum that we're able to have with you, and we've got a very comprehensive program for the session this afternoon. After me, I'll be handing over to Luca Campbell, Tegan Poole and Kathy Namzik from our Regulatory Operations Group, and they'll give you an update on the recent changes to WHS laws, a bit of a discussion around psychosocial hazards and how they may impact your workplace, and then what your role is as an HSR in identifying and responding to those hazards. We'll follow that with a panel discussion that will look at some of the current challenges and opportunities in the HSR space. And this, we look forward to welcoming Community and Public Sector Union organiser Josh Delega, as well as Mandy Kay, who heads the WHS delivery team at Services Australia, and Lachlan Whittle. Lachlan's an HSR at the Australian Radiation Protection and Nuclear Safety Agency. For that conversation. So I'm looking forward to hearing from the three again. So thanks again for joining us today. I really do hope that you find that this session will expand your knowledge and understanding of WHS issues, and that will give you new insights as to how we can make our workplaces safer and healthier. So thanks very much, and I'll hand back to you, Andrew.
Right. Thank you, Greg, for that warm welcome and officially getting the forum underway. The team have also just popped up another poll question for you, as we're keen to understand if or when you last completed the 5-day HSR training. We'll see if that matches how long you've been one or not. And someone who I know will be very keen to see the results is Luca Campbell, the Director of Comcare's regulatory programs. Among the other things that they do, Luca's team works with approved HSR training providers to ensure that HSRs are given the appropriate knowledge and understanding to undertake the role of HSR. But today, Luca's going to be sharing a regulatory update with you. So welcome, Luca.
Thanks very much, Andrew, and good afternoon all. Thank you very much for joining us for this regulatory update and for the Health and Safety Forum. It's lovely to be with you. So I know there are a few of you today from outside our jurisdiction, so I thought it might be a good starting point to just provide a brief overview of Comcare and describe our role as it relates to the broader health and safety regulatory system across Australia. So let's work through this slide here from left to right. Comcare on the left-hand side, that's us. So we're the work health and safety regulator for the Commonwealth. We administer, monitor and enforce compliance with the Commonwealth Work Health and Safety legislation. And we also have workers' compensation and rehabilitation functions under the Safety, Rehabilitation and Compensation Act. Our work health and safety jurisdiction includes all Commonwealth government departments, as well as some premium paying licensees. Now, second from the left there, we work closely with state and territory work health and safety regulators, which are established under state and territory law. And we also work closely with other regulators, including the Human Rights Commission and other regulators where we have concurrent jurisdiction and that is where the work health and safety law interacts with other laws that may operate within the Commonwealth or state or territories. On the right-hand side there, we've got Safe Work Australia. And if you'd like to hear from Safe Work Australia, they actually provided an excellent update on upcoming changes to the model work health and safety laws at our psychosocial forum a couple of weeks ago, and the recording of that has been posted just yesterday on our website. So Safe Work Australia is not a regulator, but it has a very important role to play in health and safety regulation, particularly in the development and coordination of policy and law reform. So hopefully this gives you some insight into how Comcare and other regulators work collaboratively to continually improve health and safety conditions in the workplace. Now, I just want to re-emphasise a few of the points that Greg made earlier, and that is to say that we place immense value on the role of HSRs and have a very strong appreciation for the work that you all do in making workplaces safer and representing your work groups on very important work health and safety issues. We consider HSRs as essential partners in our regulatory activities, and we know that HSRs are pivotal in fostering a collaborative work environment and addressing health and safety issues as they arise. We also know that HSRs have a critical role in prevention and preventing work-related injuries and illnesses. And on that note, we're committed to engaging collaboratively with HSRs in our role as the work health and safety regulator for the Commonwealth. So I'll touch on a few ways, just briefly, that we do engage with HSRs, just to expand on the really important points that Greg outlined in his welcome address relating to the uplift we have at the moment in terms of raising the profile of HSRs in our jurisdiction. So in addition to that, we have a number of ongoing regulatory support functions relating to the role of a HSR. So firstly, we authorise HSR training programs and provide additional training and resources to equip you as HSRs with the knowledge and skills you need to perform your role effectively. We can also provide assistance to you as a HSR and to other parties in workplace issue resolution. Thirdly, through our Work Health and Safety Help Desk, we provide guidance and advisory services to HSRs, helping you navigate complex health and safety issues. And importantly, we engage with HSRs as part of our monitoring, compliance and enforcement functions. And on that note, so what that sort of looks like in practice, during workplace visits, our inspectors will always ask that a HSR is notified, that an inspector's on site, and where appropriate, we'll invite HSRs to accompany our inspectors and assist with our inquiries. So I'd like to turn now to the topic of how we regulate psychosocial hazards and risks in the workplace and the strategic activity we have underway here on that topic. As part of our planning process, we've identified strategic priorities that will guide our work between now and 2028. You'll notice the first priority here is to prevent work-related injuries. We'll focus our efforts on the prevention of psychological injuries in particular, in order to drive positive change to make workplaces safer. We've also identified psychosocial hazards as one of our 6 regulatory priorities. And if you'd like to learn more about our regulatory priorities, you're welcome to view our webinar on this topic, which is also available through our website. For Comcare to regulate effectively, it's important for us to have information about contemporary issues in our jurisdiction. And one of the important sources of information that we rely on, which you may be familiar with, is notified incidents. So notified incidents are reported to us under Section 38 of the Work Health and Safety Act. On the screen here, you can see the number of notified incidents we received over the last 3 years, and we've broken it down into those incidents relating to psychosocial hazards or risks and physical or all other hazards and risks, I should say. So that's in the blue colour. So up until 2023 to 24, the number of notified incidents related to psychosocial hazards and risks remained stable. We did see we did see a significant increase in 2023, and it's possible that increase was due to a greater understanding and awareness by PCBUs in relation to psychosocial matters in the workplace. We think it's also due to some targeted engagement we had with specific PCBUs in our jurisdiction, and that's one of the explanations behind that rise in notified incidents. Now, of course, in addition to notified incidents, you're probably aware that we also receive work health and safety concerns from workers, HSRs, or other persons, and that's through our work health and safety help desk. Interestingly, the number of work health and safety concerns we've received relating to psychosocial matters has actually remained steady over the past 3 years. Of the 223 concerns related to psychosocial hazards we received over this period, the most prevalent one was bullying, and it accounted for about half of the work health and safety concerns that we received. Now, one of the actions we often take when we receive an incident or work health and safety concern is that we assign an inspector to assist in the matter and conduct monitoring compliance activities such as a workplace inspection. Here we're looking at the number of monitoring compliance activities we undertook over the last 3 years related to psychosocial matters. Now, again, you'll notice the sharp increase in 2023 to 4, and the majority of this increase was in response to the notified incidents that I mentioned on one of the previous slides. So the data I presented just then illustrates the need for us to continue our focus and our efforts on prevention, particularly when it comes to preventing harm from psychosocial hazards and risks at work. We've set out to be a leader in the prevention of psychosocial injuries in particular, and to increase our influence, appropriately sharing insights to effectively drive positive change with employers and employees. Our focus areas when it comes to prevention are to optimise regulatory and safe work approaches, enable employers to prevent work-related injuries, and to improve prevention through insights, innovation, and influence. So I'd like to spend a moment now just unpacking the term psychosocial hazards, and I know for a lot of you this will be revision, but it just is important for us to keep coming back to the term and what it actually means. I know that Kathy and Tegan will have a bit more to say about this during their presentation as well. The term psychosocial hazards is one that probably seemed quite unfamiliar to us a few years ago, but it has become a critical part of our language in health and safety in the contemporary environment. Psychosocial hazards are hazards relating to or arising from the design of work environment, plant at the workplace, or workplace interactions and behaviours, and they may cause psychological harm. Now, we know that psychosocial hazards may also cause physical harm as well. So it's not just psychological harm that we are worried about when it comes to psychosocial hazards. We know that there are at least 14 psychosocial hazards set out in the Model Code of Practice, and these are displayed on the screen for you now. I won't go through each of the 14, but all I will say is that they're grouped into 2 broad categories: hazards relating to the design or management of work, and hazards arising from harmful behaviours. It's important to remember that hazards may interact or combine to create new, changed, or higher risks. Some of these hazards may not create psychosocial risks on their own, but may do so if combined with other hazards. The non-linear and often compounding effects of psychosocial risks can be a challenge, but we think it's certainly a worthwhile challenge when we think about the significant economic and social impact of work-related psychological and physical injuries. When not adequately managed, psychosocial risks in the workplace have a number of negative consequences. I've listed them out on the screen now, and just to highlight a few, psychological injuries such as anxiety, depression, or PTSD, physical injuries including musculoskeletal disorders, and this is due to the strain of stress on the body and the sympathetic nervous system activation. We also know that there's a lot of business impact on psychosocial risks in the workplace, including things like reduced productivity, poor morale, and unscheduled absences. And this creates a significant economic risk. So it can contribute to significant economic impact to individuals, workplaces, and society. But it's not all doom and gloom. Rising to the challenge of creating mentally healthy workplaces comes with a range of benefits that extend beyond health and safety outcomes. We know that a mentally healthy workplace can reduce absenteeism and lost working days. It can increase productivity and lead to greater job satisfaction. It can reduce staff turnover and help to attract and retain talented workers. And importantly, just on the economic front, we know that from economic analyses, every dollar spent on evidence-based mental health actions, an organisation can receive a return on investment of about $2.30. It's important to note, though, that the most important benefits are perhaps unquantifiable, because we all know that mental health is a critical aspect of our overall well-being. Comcare has a dedicated psychosocial regulation team within its regulatory operations group, and you'll be hearing from Kathy, who leads that team in a moment. The team was established in 2022, and for most of the time since then, it's been staffed by a team of 4 inspectors. We're currently going through a growth spurt of sorts, and we've just welcomed an additional 5 inspectors to the team, bringing the total number of inspectors to 9. Although we have a specialist team, our philosophy has always been that in the contemporary environment, all health and safety inspectors need to know how to regulate psychosocial risks. So we work very closely with our colleagues in the regional inspectorates to help them to navigate what is sometimes a quite complex subject matter and a new area of regulation for us as work health and safety inspectors. This approach facilitates a multidisciplinary, collaborative style within the inspectorate, and it enables us to deliver targeted and proactive regulatory programs. One of the key deliverables for the psychosocial regulation team has been the proactive psychosocial inspection program. The program was piloted in 2023 through to the beginning of this year. And we engaged the University of Queensland to conduct an independent evaluation of that program. The evaluation looked at the program processes and resources and involved interviews and surveys with participants at all 3 tiers, being senior officers and senior leaders of an organisation, workers within the organisation, and specific engagements we did with health and safety representatives and health and safety units. The evaluation found the program met its objectives, and it was perceived positively by all those involved. Of particular note, 92% of participants agreed that their knowledge of the range of psychosocial hazards had improved. 85% of participants reported an increase in commitment to psychosocial health and safety, and 70% agreed the program assisted their organisation to comply with work health and safety laws. We received 18 recommendations for improvement, predominantly in the tools and resources for the program, PCBU communication methods, and data collection processes. We've accepted those recommendations and will be guided by the findings of the evaluation as we work through our transition to full-scale implementation of the program in early 2025. We're also in the process of creating a specific website for the proactive program with additional resources, guidance, and information about our approach. We'll be releasing that in the near future, so do keep your eyes out for that further information. Once again, thanks very much for having me today. I hope you found that information useful. I'll hand back now to Andrew, who will introduce the next speaker.
Great. Thanks, Luca. And a few questions in the chat about recordings. Yes, absolutely. We'll definitely have the recording available and the slide deck as well, and any additional resources that we sort of mention as we go through the presentation as well will be available for you. We've just popped up another question because there was also some chat about doing the 5-day refresher. I thought maybe, doing the 5-day training, and I thought maybe I only had to do a refresher if I've done that once. Absolutely correct for some of those people who mentioned that. We're keen to know if you've undertaken a refresher course or not, or if you plan to, or if you don't plan to. So there's a little poll up there for you now. So now we're going to hear from Kathy Nalonchik, the Assistant Director of Psychosocial Regulation, and Kathy Teagan-Poole, who's the Senior Authorisation Officer at Comcare. And Kathy and Teagan will be sharing with you an overview of psychosocial hazard identification and management and the role of HSRs, as well as a case study that illustrates some of this in practice. And that will answer some of the questions that have been coming through the chat and the pre-poll questions as well when you're registered. So welcome, Kathy and Teagan.
Thanks, Andrew, for the warm welcome. Good afternoon, all. My name is Kathy, and thanks for joining in on our session. It is great to see so many of you here with us today. As mentioned, this is a bit of a session outline of what we're planning to cover today, so we might get straight into it. Lucas spoke earlier about what psychosocial hazards are, and I thought it would be helpful to just take a moment to reflect on why psychosocial hazards are actually hazards. The short answer to this question is their connection to creating stress. I think we need to change the slide to the next one, if possible. Thank you. Stress is a common and normal physical and psychological response to challenging or demanding situations. Our bodies can respond to stress by releasing helpful hormones which assist us to navigate these challenges. Stress generally has a bad reputation, however, not all stress is actually bad for us. Good stress exists and it's generally experienced in the short term. Good stress is even considered healthy because it can provide us with motivation, inspiration, energy, and focus. Stress is more likely to be problematic or harmful when exposure is chronic, meaning it is severe, frequent, or prolonged. Because our bodies are not designed to release high levels of stress hormones for long periods of time, symptoms such as body stress, fatigue, exhaustion, and trouble sleeping can gradually appear. So while stress itself is not an injury, it is the experiences of the impact of the symptoms that we just spoke about that can lead to injury, such as the development of a mental health condition. Overall, psychosocial hazards are hazards because with severe, frequent, or prolonged exposure, they have the potential to cause injury. Now, to manage psychosocial hazards, a PCBU must follow the exact same risk management process that applies to all work health and safety matters. And that is that they must identify the hazards, assess associated risks, control them so far as reasonably practicable to minimise or eliminate the risks, maintain and review control measures to ensure they remain effective, and at every stage consult with affected workers and relevant HSRs. Comcare is a systems-based regulator, meaning we examine compliance of a PCBU's work health and safety management system with their legal obligations. We do this both proactively and reactively. Proactive work is a key focus of Comcare's approach to psychosocial regulation, as ultimately prevention of injury promotes and enables safe and healthy work. In this space, our proactive work includes a range of education activities, such as those detailed on the far left there. It also includes the proactive psychosocial inspection program that Lucas spoke about earlier. And as part of this program, we proactively engage with PCBUs to holistically assess their system's compliance with psychosocial hazard management obligations. Where we find any gaps or identify opportunities, we provide advice and recommendations to the PCBU. Reactive work is triggered by incidents reported to Comcare or concerns raised. Any worker, including a HSR, can raise a concern about a PCBU's safety management system relating to psychosocial hazards directly with Comcare. From these triggers, Comcare inspectors may engage with the PCBU and conduct inquiries about their safety system relevant to the psychosocial hazard identified. The purpose of this is to determine whether any non-compliance with legal obligations has occurred so that it can be remedied and future harm can be prevented. In some cases, enforcement notices can be issued, and in extreme cases, prosecution can occur. When conducting a psychosocial inspection, regardless of whether it's proactive or reactive, the focus is around two main questions. The first one being, does the PCBU have a system in place to identify, manage, and control psychosocial hazards, and is this system effective?
Thanks, Kathy. Hi, everyone. I'm Teagan. So we often get asked questions about the role of a HSR in relation to a psychosocial safety matter. The role of a HSR is exactly the same, whether it be for a physical or psychosocial safety matter. Same powers and functions apply. So as you may be aware, Section 68 on the screen now identifies the role of a HSR is to represent the workers in your work group in relation to work health and safety matters, to monitor the measures the PCBU is taking to meet their work health and safety obligations, to investigate complaints from members of your work group relating to work health and safety issues, and to inquire into anything that appears to be a work health and safety risk. So as a HSR, you are not expected to be an expert on health and safety, and this includes psychosocial matters. It is important to highlight that as a HSR, you are not responsible for fixing work health and safety issues in your workplace, and this includes those relating to psychosocial. It is up to a HSR to decide when they will exercise their powers and perform their functions, as there are no mandatory obligations on HSRs to do so. So HSRs can represent their workers in a variety of ways. So firstly, you could be a member of your health and safety committee. As a HSR, you do not have to be a member of the health and safety committee, but it is likely to be beneficial. Membership to the Health and Safety Committee enables you to be involved in consultation and discussion about work health and safety matters across the wider workplace. All HSRs are entitled to be on the relevant Health and Safety Committee. However, if there are multiple HSRs, the HSRs can decide who should attend the committee meetings. Any HSR, whether on the Health and Safety Committee or not, can request minutes from the Health and Safety Committee meetings. If your PCBU does not have a Health and Safety Committee, they must form one if requested by HSR or by 5 or more other workers. You can involve yourself by providing feedback to your work area and the PCBU during periods of work health and safety consultation. This can include feedback on risk assessments, policies, procedures, and anything that involves changes to the way the work is done that is likely to impact the work group. As HSRs, you can reach out to workers and seek and share feedback on behalf of your work group. Engaging proactively with workers on items out for consultation, particularly when it comes to psychosocial safety matters, may obtain better quality feedback as it can encourage workers to share their honest views. If a work health and safety matter affects workers in the work group which you represent, the PCBU must consult with you regarding the matter. You can represent workers in these matters by providing feedback on proposed resolution. A health and safety matter could be anything from a difference in opinion on our health and safety policy or procedure, whether something is a psychosocial risk or whether a particular control measure is adequate. At any stage in the formal issue resolution of a psychosocial matter, a worker may authorise a HSR to assist, represent or support them. The involved parties must make reasonable efforts to achieve timely and effective resolution of the issue according to the relevant agreed procedure. So there are several practical ways that a HSR can get involved with monitoring the PCBU's work health and safety compliance, and this often involves identifying psychosocial hazards. So this can be through conversations with workers. So if you're engaging with the workers in your work group regularly, are you asking them about the hazards in their work area, including those psychosocial ones? Are they raising things to you about their workloads, the workplace culture, or sensitive people matters? These conversations provide great insight into what is happening within the workplace and can assist you in forming an understanding of what may be normal versus what might be problematic and those things in between. When held regularly, these conversations can also assist you in identifying concerns at the start rather than when they've escalated. It's important to ensure that workers have appropriate and convenient access to you as the HSR, either directly, so face-to-face, or indirectly via email or telephone, and that the communication process is open. You should encourage members of your work group to ask questions about work health and safety, raise concerns, report problems, and be part of the problem-solving process. Another way you can monitor compliance is monitoring the reports that are around in the workplace. So as a HSR, you can request information from your employer regarding psychosocial hazards that have been reported. This can include incident reports, statistical reports on work health and safety matters, or similar. While you are not permitted access to personal medical information in relation to workers, broad and de-identified information can still be provided, particularly looking at trends and things like that. So keeping across any results from any internal pulse surveys or the APS survey, this can help to give you an idea of how your PCBU is performing overall when it comes to managing psychosocial risk and how workers feel about the approach by management to safety. So if you identify or are informed of a work health and safety matter and you believe there is non-compliance with the work health and safety legislation, a HSR can consult, investigate and inquire with the PCBU about the matter. This will normally be with your team leader, supervisor, manager, or could be with a contractor. As representatives of the PCBU, leaders and managers are required to discuss your concerns with you. The Work Health and Safety Act emphasises that work health and safety matters should be resolved through consultation where reasonably practicable. So some tools you have up your sleeve to commence inquiries or investigations. So you can raise the issues with management. It is not your responsibility to resolve or investigate the matter as an investigator would. Your role is to substantiate whether the hazard is a risk and to inform the appropriate people, which in the first place could be the manager of the work group. As a HSR, you are permitted to inspect the workplace. You must provide reasonable notice to the PCBU prior to undertaking your inspection. You may think workplace inspections are just looking at physical hazards. There's things that are easy to see, trip hazards, etc. However, you should also consider psychosocial hazards when you're doing the inspection. For example, what could the psychosocial hazard of job demands look like when doing an inspection? Perhaps you could walk around and observe workers at their desks. Do they appear too busy to talk to you about their work? Do they appear flustered under the pump? Things you could look out for is whether they are taking regular breaks and how colleagues are interacting with each other. These things may get you starting to think about whether this hazard is present and if it is being controlled effectively. The next step is to speak to workers about their experiences and obtain their feedback about the hazards. As a HSR, you can also request the PCBU review a control measure at any time. If it's impacting members of your work group and you reasonably believe that a control does not exist, is insufficient or requires review. Now, if all internal avenues have been exhausted, meaning a HSR has not been able to successfully resolve an issue despite formal attempts, HSRs can raise a work health and safety concern directly with Comcare. For psychosocial matters, it is important to remember, as Kathy spoke about earlier, Comcare is a systems-based regulator. Therefore, it is appropriate to reach out to Comcare once internal resolution avenues have been exhausted. For example, in the case of the psychosocial hazard of bullying, Comcare explores what systems the PCBU has in place to prevent and respond to bullying. The scope of a bullying concern for Comcare would be whether the PCBU has a system in place to prevent and respond to allegations and to determine the effectiveness of these systems. A HSR can request a Comcare inspector attend the workplace to assist in resolving the matter under Section 82. If you have a reasonable belief that a contravention of the Work Health and Safety Act is occurring or has occurred in a manner that is likely to be repeated, and you have consulted with the relevant persons within the PCBU regarding the alleged contravention, and your attempts to resolve the issue have not been successful, a HSR then may look at issuing a provisional improvement notice. If the matter is exposing workers to an immediate or imminent threat, a HSR can direct workers to cease work. To issue a provisional improvement notice or to instruct workers to cease work, a HSR must have completed the Comcare approved 5-day HSR training course. So if you haven't done your training, recommend.
Thanks, Tegan. With the sensitive nature of psychosocial matters, it may happen that a worker raises a concern with you and requests that you address their matter without revealing their identity. Although HSRs are not legally bound to confidentiality following disclosure of an issue by a worker, it should always be respected unless there is a compelling reason. In situations where a worker requests anonymity, HSRs can consider alternative or informal ways to address the risk, such as raising the theme of the issue in a de-identified way with either the Work Health and Safety Committee or the Work Health and Safety team directly. With de-identified reporting, caution should be exercised with specific details shared to avoid unintentionally identifying a worker. This risk can be mitigated by having a conversation with the worker around expectations. This includes explaining the possibility of unintentional identification and also clarifying the exact information that the worker is consenting for you to share. It can also happen that a worker raises a concern with you and requests that you take no action and tell nobody. This can feel like an ethical dilemma, as you are now aware of a hazard but feel like you can't really do anything about it. However, there is a lot of power in what you actually can do, and what you can do is provide information. You can provide information regarding internal reporting or resolution pathways available. I would encourage you to familiarise yourselves with internal policies and procedures, as PCBUs often have separate procedures to navigate different hazards, such as workplace bullying or sexual harassment, so it's best to be equipped with this awareness ahead of time. You can encourage a worker to keep a detailed record of events, including witnesses, which can assist them in the future if they wish to make a formal report. You can provide information about what a worker can expect when lodging a formal report. If you're not sure, you can always reach out to your work health and safety or HR team to find out. You can also connect a worker with information and resources about the hazard that they're experiencing. For example, Safe Work Australia has a great resource called Dealing with Workplace Bullying, a Worker's Guide, which details very practical information. This information alone can be very powerful and should not be underestimated, because it can empower a person with the information that they need to make a fully informed decision about what is best for them. If a person does not want to formally report their matter, that is okay. Ultimately, a person is best placed to make the right decision for themselves. It is worth noting that the Work Health and Safety Act does not impose a duty on a HSR to act on information they receive. HSRs are not personally liable and cannot be prosecuted for actions taken in good faith while exercising their powers or performing their functions under the Work Health and Safety Act. Now, with saying that, whilst HSRs are not bound to confidentiality where it is requested by a worker who proactively discloses an issue, HSRs are bound to confidentiality of information that is gathered during the use of powers or functions as per Section 271 of the Work Health and Safety Act displayed on the screen. Now, there are some exceptions to this rule, and you can refer to this section of the Act for further information if you require. Now, given we have this platform today, I just also wanted to take the opportunity to highlight that the Work Health and Safety Act prohibits a PCBU from discriminating against a worker because the worker is, has been, or will be a HSR, a deputy HSR, or a member of the Health and Safety Committee. Examples of discriminatory conduct are listed on the screen here, and it is important to acknowledge that the threat to take any of the actions listed here is also considered to be discriminatory conduct. Comcare considers discriminatory conduct to be unlawful in certain circumstances, including when powers are exercised to perform functions under the Work Health and Safety Act, or when an issue or concern is raised to a person, such as a PCBU, Comcare inspector, or to another worker. Comcare takes allegations of discriminatory conduct against HSRs very seriously, and both criminal and civil penalties can be brought against a person who engages in discriminatory conduct in relation to work health and safety matters. If you ever feel you're being discriminated against because of your role as a HSR, please contact Comcare for advice and assistance.
Thanks, Kathy. We're going to run through a bit of a case study to demonstrate how some of the information we've kind of spoken about today could be used in practice. So our current situation. So a PCBU has a call centre as part of its operations. Due to recent legislative change, the PCBU has had to change some of the services available to its customers. This is resulting in an increase of customers contacting the call centre to either clarify or dispute the service changes. The work health and safety issue. Workers of the PCBU are experiencing an increase in aggressive callers, including threats of violence towards call centre workers. Workers are feeling stressed and anxious. Workers have spoken to their line managers about their concerns regarding the increase in customer aggression and the effect on their psychosocial wellbeing, but there have been no changes made at the workplace to address the issue. Several workers approached the HSR, SHRIM, for their work group to see if they can assist in resolving the issue as the nominated representative. Now, following consultation with workers to gather further information about their concerns and the desired outcomes, SHRIM identifies that the issue relates to the psychosocial hazard of violence, aggression, and high job demands, as detailed on the screen. This is coming from sources both internal and external to the PCBU that are reasonably foreseeable to control. SHRIM concludes that while the risks to health and safety are real, there is no serious immediate risk to health and safety, and it's not necessary for him to exercise his HSR powers, such as directing work to cease or to issue a provisional improvement notice at this time. SHRIM provides information to workers about the internal reporting pathways available to them via the PCBU's Work Health and Safety Unit. SHRIM informs the workers he can support them in this process by keeping across the reporting process and being available to them in his role as a HSR. As this matter is affecting the whole work group, the workers suggest that the matter may be most efficiently communicated if SHRIM raises the workers' concerns collectively. SHRIM has no obligation or responsibility to accept this request. However, SHRIM is comfortable with undertaking the workers' request. So the workers suggest he speaks with their EL2 manager, Chantel. SHRIM reaches out and initiates contact with Chantel via email, identifying himself as a HSR and requests time to meet with her about the psychosocial concerns. In preparation for the meeting, SHRIM reviews the work area's risk assessment and identifies that there appear to be minimal controls in place relating to customer aggression, and that this risk assessment has not been updated since the legislative changes came into effect. During the meeting with Chantel, SHRIM provides an overview of the workers' concerns and the hazards identified. SHRIM requests that the PCBU review the control measures for these hazards, as the workers have described significant impact, the concerns relate to a legislation change that has created additional risks to their health and safety, and the risk assessment controls do not appear sufficient. SHRIM requests that interim control measures are put in place while the formal risk assessment and worker consultation process takes place. SHRIM refers Chantel to the Model Code of Practice, Managing Psychosocial Hazards at Work, for information on possible controls to consider, and reminds her of the importance of consultation with workers. Chantel and SHRIM agree to meet in 2 weeks to discuss. After the initial meeting, SHRIM sends Chantel a brief email summarising the discussion, including Chantel's commitment to remedying the issue. SHRIM then emails an update to the affected workers about the outcome of his meeting with Chantel and the date of their follow-up meeting. He requests that they provide feedback on any changes relating to their concerns within the workplace prior to this meeting.
Okay, and 2 weeks have now passed, and SHRIM receives feedback from workers who report that the work area management have sent an all-staff email promoting the availability of support via the Employee Assistance Program. It is also reported that posters in the call centre with steps on how to deal with aggressive customers have been put up. Workers indicate that, to their knowledge, no other action has been taken and express that the hazards remain an issue. SHRIM attends his scheduled follow-up meeting with manager Chantel, who explains the actions taken, which match the description provided by the workers. Chantel advises that there has been insufficient time to take any further action. SHRIM respectfully disagrees about the insufficient time and advises that he will now contact the Work Health and Safety team to formally raise the issue as per the PCBU's issue resolution procedure. The Work Health and Safety team then sets up a meeting with manager Chantel and SHRIM. They discuss the issue, actions taken to date, and further action required. Based on feedback he obtained from affected workers, SHRIM shares suggested interim control measures that can be implemented whilst the formal risk assessment and worker consultation takes place. Chantel agrees to these interim controls, which includes providing clear directions for workers to terminate a call if aggression is unable to be de-escalated, and the availability of a 10-minute break for workers following a distressing call with the opportunity to debrief with their manager if required. The Work Health and Safety team emails a summary of the meeting to SHRIM and Chantel, including the actions committed to. SHRIM agrees that the meeting record is accurate and updates the affected workers accordingly. After 1 week, SHRIM checks in again with workers. Whilst there are still more aggressive calls than usual, workers report feeling more safe and supported in managing their work because of the interim measures that have been implemented. Workers confirm that they are providing detailed feedback on the risk assessment. From this time onwards, SHRIM remained informed of the progress of the resolution from all relevant parties. In the end, the issue was resolved as the work area implemented long-term control measures and identified a clear review and monitoring strategy. Had the issue not been resolved through the action he had taken, SHRIM would have other avenues available to him, including issuing a provisional improvement notice if he believed that the PCBU was contravening a provision of the Work Health and Safety Act, or requesting Comcare to appoint an inspector under Section 82 of the Work Health and Safety Act to assist in resolving the issue. So through this scenario, we've demonstrated how a HSR can become involved to assist identification, resolution of a psychosocial hazard, exercise the power to request a review of controls, request the assistance of the PCBU, and stay across the matter to monitor resolution without taking on that primary responsibility to manage or fix the issue. So this takes us to the end of our presentation. Should you require further information, there are several resources available to all HSRs, and on the screen are just some examples for you. A reminder that you can sign up to Comcare's HSR network to receive regular communication, including news, events and resources. And for those of you who are covered by the Comcare scheme, should you require assistance, you can call us on our dedicated phone line or send through an email to whs.help@comcare.gov.au. I understand these may have already been shared in the chat, but they might be shared again. And for those who are outside of Comcare's jurisdiction, refer to your usual regulator for further assistance. Thanks so much for your attention, everyone.
Great. Thanks, Kathy and Tegan. And yes, there were a few comments or questions in the chat about Comcare, its jurisdiction and coverage. So just to help people, Comcare regulates a national jurisdiction that includes the Australian Public Service and also a range of licensees who the relevant Minister and Safety Commission have enabled to be covered under the scheme. So if you're not completely sure, feel free to reach out to the WHS help desk to confirm whether your organisation is covered by Comcare or not. And Comcare is a similar jurisdiction in some ways to other safety regulators, New South Wales, Queensland, etc., work cover authorities. So it is a separate and distinct jurisdiction. Now, yes, and also reinforcing that WHS help desk, there were a few specific questions that came through in the chat with particular examples or circumstances. Again, WHS help desk is the right place to be asking a specific question, and we'll hopefully be able to direct you, consider the question and direct you to the right place. So thank you. So next up, we've got a panel session to address some of the questions that you and others in the audience have sent through when you were registering, and some of the ones that have been coming through the chat as well. So I've got the pleasure of welcoming Josh DeLiga, who's lead organiser from the CPSU in the Work Health Safety space. We've got Mandy Kay, Director of the Work Health Safety Delivery Team in Services Australia. We've got Lachlan Whittle, a HSR with the Australian Radiation Protection and Nuclear Safety Agency. And we've got Mark Shortis, who's an Assistant Director and Inspector from Comcare's Regulatory Operations Group. So I might just go around the room and let yourself introduce yourselves and your connection to HSRs. So Lachlan, I saw your camera come up first, so perhaps yourself.
No worries at all. But yes, I'm Lachlan Whittle. I work for the Australian Radiation Protection and Nuclear Safety Agency, which is actually Australia's federal nuclear regulator, but I'm not here for that reason at all. I am the HSR for our office, and so I am an HSR, which is my relation to being an HSR. So I'll hand over then maybe to Josh.
Hey, everyone. Thanks for having me today. I'm Josh DeLiga. I'm one of our Work Health and Safety lead organisers at the CPSU. I work with organisers, with bosses, with the regulator and with members to support our members getting the best work health and safety outcomes in their workplaces.
Perfect. Mark or Mandy?
Mandy, you want to go first?
Sure, I'd be happy to. Hi everyone, Mandy Kay, I'm the WHS Delivery Team Director of Services Australia. Dealing with HSRs over an expansive career. I'm used to work for the South Australian regulator, where I was able to help and assist HSRs navigate their way through the Act and dealing with issues, having to make decisions around some PINs as well. And then I've brought that experience to help provide advice and support leaders within Services Australia to understand what consultation is, what is good consultation, and as part of my role, also develop the health and safety consultative arrangements for Services Australia. Mark, over to you.
Great, thank you for that, Mandy. Thank you, everyone else, and thank you for having me. My name's Mark Shortis. I'm one of the assistant directors in the Sydney office of Comcare. I'm also appointed as an inspector, so I go out on inspections where I, and this is where I get largely involved with health and safety representatives. I get involved with health and safety representatives out on inspections, often on a reactive space, so when there's been in response to an incident, but also particularly my favourite is proactive inspections. Comcare has a proactive inspection program undertaken yearly. At the moment, we're focusing on consultation, coordination, and cooperation, and we'll be attending sites, and you may see me at a site from time to time. Also, I have been a HSR in the past. I've been a HSR for with Comcare and at previous workplaces.
Great. Thanks, all. So the first question that we've got here is, how can HSRs access time to be able to perform their powers and functions, particularly in scheduled environments? And maybe we might start off with you, Mandy.
Yeah, thanks, Andrew. So first of all, I will say that it really depends on the function that an HSR is undertaking, but I always like to see that HSRs are doing around 1 to 2 hours per week. And being in a scheduled environment, it's really important that HSRs work with their leaders to get that time allotted. Really lock it into the schedule so you've got that time that if people want to come and have a chat with you or you want to do it, use it for a particular function like monitor compliance, look at health and safety committee minutes, go through some data and the likes. But it's really important that when you consult with your leaders that you actually be clear on what it is that you're doing. Try not to be vague because that helps to make it clear for the leaders what it is that you're doing and make it clear that it is part of the function of an HSR and how in turn that really helps the work group for which you're representing. And the other tip is see if you can get it into some consultative arrangements within your agency or the workplace, that because once you've locked it in there, it's a lot easier for you.
Somebody else want to weigh in on this one as well? You want to add to?
Yeah. Oh, I was just going to say, just to compliment Mandy, what Mandy was saying is it's really good to be open and upfront with your manager as to what your role is, that you are elected to have to represent the workers in your work group, and to be really proactive in the things that you're doing, like time per week. You know, some agencies do provide you with a scheduled workers with a few hours, and they might put that at like at a quiet time in which calls or customer interactions may be in a less demand. You know, that would be quite reasonable for you to do planned activities. However, there might be times where there's imminent or urgent things that do pop up, and I would say to HSRs to be really confident to be able to take the time when there are those urgent matters to just get up, do what you've got to do, and then as soon as possible, go and have a chat to your manager and say, hey, look, I've just had to do this here because it was quite urgent to do. And you know, and this is this has taken up an hour of my time today. For our members in particular, you know, we've got a guide for you to be able to go through and how to have a conversation with your manager. It's to know your work health and safety rights as a health and safety rep. It also gives you some suggestions for your performance agreement. So you might want to put in your annual performance agreement that, look, I've got KPIs that I might have to meet, but I'm going to have a few hours per week and ad hoc things that are going to come up, and put it in your performance agreement so it's really clear from the outreach that you'll be spending time to do that.
Yeah, great. Mark or Lachlan, I'm not sure if you'd like to share if you had some direct experience with having to negotiate this or not.
I'm very lucky. Oh, sorry, Andrew. I was just going to say I'm very lucky because you know my organisation is a safety regulator. You know, my management very much prioritises and understands the need for HSRs and the roles they do. So I haven't had to negotiate that a lot. But I'd say the most obvious example of time allotted is I am, and all HSRs in our organisation are on the Work Health and Safety Committee. So that's probably the most overt example of this is a time that's blocked out. I'm not expected to be doing anything else. That's where I am.
Terrific. And the team have just popped in the chat a link to the e-learn around health and safety representatives' role. And that's also quite a good way to nudge your manager or supervisor towards, so they understand, what's required in the role, and can lead into having, an open, transparent conversation around, what's involved and how much time might be necessary, and that sometimes it will fluctuate depending on what's going on. Thanks, guys. So, somebody also asked where we got these questions from. They came through the registration process when people registered for the forum. So thanks again, everyone who's put questions in. Really makes a difference. So next one we've got there is, how can HSRs support their work group where workers identify psychosocial hazards? We talked about this, Tegan and Kathy. Lachlan, do you want to kick off a little bit of conversation around this?
Cool. And yeah, exactly what you just said. I think Kathy and Tegan gave an excellent answer to this, and mine might be inadequate in comparison, but that's okay. The main thing that I would say is, I think, as an HSR, our role stays exactly the same, regardless of whether it's a psychosocial hazard or a traditional physical hazard. Our job is to represent the workers in our work group on anything health and safety, psychosocial included. The only real difference might come around maybe support, sensitivity, and maybe education. You might have workers coming to you who might raise something but not actually know that it falls under psychosocial hazards. They might not know what psychosocial hazards are. So there might be a bit more of an education piece there, where you sit down with them and just help them understand what these are, what the PCBU's responsibilities are to you in that regard. And then to understand that people generally, there's a lot more sensitivity around if it involves people's personal mental health. So that consent piece before talking with anyone else is, I think, an even bigger priority for that than maybe some other issues. And that you really want to make sure that you can try to educate the work group as a whole whenever possible, because this is an issue that is going to come up. It's pretty new for a lot of people. A lot of people don't have the background. So we just want to make sure that everyone can be on the same page as much as possible. And that might extend to conversation with management. So I think the best thing you can do as an HSR really is educate yourself. A ton of resources have been pointed to here today. And if you can find them yourselves, and as an HSR, know that you're aware of what's out there, I think that's really the best thing you can do.
Right. Thanks, Lachlan. Just holding space if anyone else had other views.
I was just trying to turn off my mute button. Sorry. Look, I think those points that you raised, they're really good, Lachlan. What I might add to that is using some of those skills to like active listening. Really listening to what they've got to say. And I think Lachlan was alluding to that, listening to what they've got to say, having an open mind to what your workers are saying, but also bear in mind that sometimes that people in your work group might come to you in distress. Particularly if there's psychosocial hazards in the workplace. And whilst you're not there to act as a counsellor, sometimes you may be treated like a counsellor. It's just mindful to bear in mind that when someone is in distress and they come to you, that there are supports out there available to them. You've got your EAP, perhaps you've got some mental health first aiders. So I would recommend you refer them on to those resources as well if someone is maybe in distress or struggling with mental health issues or psychosocial hazards.
Terrific. I might also mention you don't have to be an expert either. So, really be sure to not take the pressure off yourself that you don't have to be an expert in all hazards and all, particularly psychosocial. There's a lot in the space. As Lachlan mentioned and others mentioned, there is resources and guidance out there. Comcare is continuing to add to that space and add things in. We do have a dedicated psychosocial health and safety forum where we provide information and guidance around some of these things with some case studies and examples, and we'll continue to add in there. So if you're looking, you can look on Comcare's website, Safe Work Australia, and a range of other resources that we'll have some links to in the resource pack afterwards as well. So if there's any other contributions, otherwise I will jump to the next question.
I was just going to say, it's really HSRs have got that really good opportunity to investigate. There might be, if there's an imminent or an immediate risk, that's resulting. Obviously, you've got your powers and functions, but if there isn't an immediate or imminent, but there are systemic issues, then you can use your powers to request risk assessments. You can look at the measures that the PCBU has taken to address and to, hopefully to eliminate the hazards, or, to control them at the very least. So, yeah, definitely use your powers where you need to.
Yeah, great. And that's a perfect segue too. Thanks, Josh, because the next question we do have is a question around risk management and working out what's the likelihood and potential consequences of a hazard. For example, it'd be possible for a paper cut to result in a fatality if it led to an untreatable infection, but that's probably not the most likely or potential consequences of a hazard like that. Mark, do you want to weigh in on risk management?
Yeah, and look, first of all, this is a really good question and something that I've come across in my career in safety and also as an inspector. So, obviously, one of the key aspects of the Work Health and Safety Act is about taking a risk management approach. And I suppose part of a core aspect of the risk management approach is consequence and likelihood, your typical risk assessment. So, I have had the question before about a paper cut, sepsis arising for a paper cut, or I've even heard, and I'm not trying to minimize this in any way, shape or form. I mean, these are potential outcomes, getting a psychosocial injury from too much junk email or too much spam. Whilst there's potential outcomes of, sepsis from a paper cut, it's not really on the scale of likelihood. It's probably not the likely outcome. And whilst risk assessment, determining what's likely or what's a likely likelihood or a likely consequence, we can base it on evidence. So we can get evidence from things like codes of practices, from Australian standards, from people, subject matter experts, and even talking to some of your colleagues or your managers about that. And they'll be able to sort of, maybe if you've got a thought about a particular hazard, sometimes it's good to go to them with a bit of a sounding board and say, I've got this hazard. I think this is, particularly when you're doing risk assessments, I've got this consequence and this likelihood. What do you think about that? And that's all part of that consultation process as well.
Yeah, thanks. Mandy, I'm not sure if you want to weigh in here as well around the likelihood and consequences of conversations around determining this and approaches towards that.
Yeah. Thanks, Andrew. And I'd sort of reiterate what Mark's already said. It is important that we get it right, because otherwise what you're doing is that if you all of a sudden are saying something is going to be catastrophic and it's likely going to happen, then you're not able to identify what are the high risks, because then everything becomes a high risk. Then everything's white noise, and then you don't get to pinpoint what are your critical risks. And that's really important, because you can't fix everything today. You need to be constantly working on it. So it's really important that you get that likelihood and consequence right, so that you can prioritise the risks that you need to manage as well. And so I have in my time seen people under or overvalue a particular hazard, and sometimes you get people where they everything's catastrophic, and then you get the others where she'll be right, mate, I've done this before, I've done it for years, it's never going to happen, I'm okay. You need to get the balance. So I think another good aspect is to look at, well, what are the trends? How often is that particular hazard presenting? And when you look at those reports, what's the most common outcome? So is it a first aid injury, or is it time off? Is it medical intervention, or someone actually needs to go to hospital? So you need it is a sweet spot. You don't want to over or undercook it. And I think you can't do it on your own. You need to collaborate with others to find that sweet spot.
Yeah, thanks. I think some really sensible words there, Mandy. That's very much the power of consultation and collaboration. Where you may have an individual who has one particular view and quite happy to go skydiving, another person who's very risk averse and not prepared to do that. So what's a reasonable risk for one person is quite different to others. But when you have a collective view, then that helps to kind of moderate and kind of get to some sort of sweet spot of, as a collective, this is where we're kind of landing. So yeah, thanks. So next one we've got there is for Josh, which is how can a HSR use their powers and functions to seek the assistance of another person, if you're looking for some help?
Thanks, Andrew. So look, the Section 68 of the Act gives HSRs their broad suite of powers and functions, as we all sort of know. And this exists to, under Section 68(2)G, it allows HSRs to seek the assistance of any person. And this allows you to be able to seek expert advice or advice and assistance about any matter in which you might need some help with. HSRs are often, may feel like little fish in a pond when it comes to being able to support issues that arise in the workplace. And in my role, some of the work that I do is supporting HSRs when they seek our assistance. And it could be, how do I write a PIN, or, can you attend a meeting with management with me to be able to provide support, that sort of stuff we can do. But it also can come down to other things. You might have identified that psychosocial issue in your workplace, and you might want to do an inspection, and that could be a survey. And we've gone into workplaces, under Section 68(2)G to support a HSR to run a survey in their workplace, and just to be able to provide that support to them. And often that can be followed up with us using rights, under, for example, to right of entry, to investigate a suspected contravention, or to consult and advise with workers. But it's really a support mechanism available to health and safety reps, because, bosses will often be beefed up with support from health and safety, from their HR or from their work health and safety teams, with experts like Mandy and that. And from where we sit, we're here to make sure that workers feel like that they've got their back, and workers are able to seek our assistance to perform their roles in the workplace.
Thanks, Josh. We've got one here about what can HSRs do to become more confident in their role? And Lachlan, as a HSR, I might throw this one your way.
Sure. I think the number one thing is to do your 5-day HSR course. You get to sit in a room with an expert running the course, and ideally other HSRs, which means you can raise all the questions you have, you can learn your responsibilities. And the most kind of reassuring thing I took away from that course was the fact, and it was mentioned earlier in today's event, that we aren't liable. That, ultimately, if you practice in good faith and are just trying to do the best you can in your role, you're all good. That is such a thing that can, thinking that you might be responsible, or there could be consequences if you do something wrong when you aren't an expert, is a massive thing that can shake your confidence as an HSR. So finding out that's not even a thing can massively boost your confidence. There's also the 1-day refresher courses, all of the resources that were talked about today. So there's the Comcare website, Comcare resources, there's the Safe Work Australia Code of Practice on lots of things, but also specifically psychosocial hazards. There's the HSR network that Greg talked about right up at the beginning at the Comcare conference this year. There was an HSR networking event where you could actually meet other HSRs. Hopefully there's HSRs in your organization you can talk to. And I think the best thing I'm lucky that where I work, there are quite a few other HSRs, and they have a lot more experience than I do in a lot of ways. And so they have been a massively fantastic resource. Talk to other health and safety professionals at your organization if you have a WHS manager or a team like that, and participate in your work health and safety committee, because that means that you're going to be aware of what's going on at your organization. You're going to kind of be aware of the stakeholders in work health and safety at your organization. And I think that's what I'd say for that one. There's probably a laundry list of others.
Yeah, Thanks. And you mentioned the 5-day HSR training and the refresher course, and there was some chat earlier in there about, gee whiz, the 1-day refresher, having to do that every year is a bit onerous. And just sort of to clarify that that is not a requirement that HSRs must undertake that refresher training every year, but it is an entitlement, so that if you feel you need to, when you want to, your employer needs to support you in undertaking that refresher training at least once a year, if that's something you feel is necessary and you want to do. Great. It also gives you sort of update if there has been changes to legislation and those sorts of things. You kind of get the latest. So next one I've got there is, how can we best encourage or support positive two-way consultation between HSRs and PCBUs? And Mandy, I might throw this one to start off with for yourself.
Sure. And this is kind of advice that I give leaders and HSRs, because it's sort of, you have to do it together. One of the things is I recommend that you work on building trust between an HSR and the leaders, having open and regular conversations. So getting involved, as Lachlan was saying, the health and safety committees, which are really good, engaging in regular meetings with leaders. Maybe if you've got a site leader, that you ask for a monthly catch-up to build rapport and get to know that leader, and start to share information and demonstrate where HSRs are really helpful and really useful. I think it's really important. I always talk about having polite and collaborative discussions, and I really encourage that people develop rapport early on, so that your first interaction with the PCB representative is not through a period of conflict, because it's very hard to come back from that. And what I find is that where there is conflict, invariably HSRs lose their enthusiasm for the role. And then you can see that HSRs either resign or they don't put their hand up at the end of their term. It's really important that we have a mixture of fresh but also long-term HSRs, and building that collaboration so you have a positive engagement is really important. One of the other tips is that look at the issue, not the person. So, you might not be mates with this person. You don't have to be, but stick to the issue and get to understand what compliance looks like. So in my experience, particularly when I was an inspector, HSRs would issue PINs or work cessation orders, and they've got themselves in a really difficult situation, but they're asking for something that goes beyond compliance or beyond what the Act or regulations ask for. So when you're dealing with an issue, do your research, have a look at the Act, the regs. The Code of Practice is a really good tool because that gives you practical guidance on what you should expect in your workplace. And that also helps with that confidence issue as well. So it is a two-way street, but if you start the relationship softly, build that trust, and then if and when the time comes, you've got some good rapport and goodwill in your back pocket for when you really need to use those powers.
Yeah, nice. And a comment that I saw come through is, maintaining a curious and problem-solving mindset, open to recognising that there's more than one perspective to any issue, can really be helpful too.
I just wanted to add a really good point that you mentioned back there, Mandy, is about attacking the problem, not the person. What we see sometimes as an inspector and just in general life is sometimes we see some people, and I've seen it from HSRs, I've seen it from managers, I've seen it from inspectors, I've seen it everywhere I go, is sometimes there's these interpersonal conflicts that gets in the way of relationships. And sometimes there's not a lot of someone might say something wrong. We say things wrong from time to time, and there might not be intent to it. And sometimes those things can be taken the wrong way. We just need to reflect on some of those. I think sometimes we just need to take a step back. If someone says something we don't like or that is potentially problematic, we just need to sort of step back and think about how that might be perceived and what the actual intent might have been.
Yeah, nice. Thank you. Next one we've got there is about elaborating on the role or expectations or obligations on a HSR attending meetings as a support person. And I might throw this one your way, Josh.
This one here is something that I often talk to HSRs and bosses about as well. And one of the things that will often come up is if a HSR is often a union delegate as well, and they hold a dual role. So you've got rights under your enterprise agreements, and then you've got powers and functions under the Act. And I would say when we're talking about HSRs exercising their rights is you want to always make sure that you're letting the people know, everyone knows what hat you're wearing at any particular time. It doesn't mean you can't wear both hats, because safety is absolutely union business. But if you are absolutely using the rights or your powers and functions, and to make it clear, and you are able to be there to represent. And it's not, I think, support person is there to hold somebody's hand, but you're a HSR, you're represented and elected to be able to represent, and you can use your powers. It's not just, I'm just going to use one of them. Kathy and Tegan were talking about, we represent, we monitor, we investigate, we inquire. You can do them all hand in hand when you are there to support a person, so it's but be really clear as to what you're doing when you're exercising it, and represent, and again with the proviso that the person may only want you there as a support person to hold their hand. That's perfectly fine as well. Just be led by the person, and if you're unsure, don't provide the wrong advice as well. I would say, find out before you give that advice. Yeah, nice. We've got a question kind of edging on the technical here, which is what makes a good PIN and what doesn't? And I might throw that one to the inspector in the room, Mark.
Great, thanks, Andrew. Again, another really good question. Look, but I just want to take a step back about what makes I suppose, a good PIN or maybe a not so good PIN. Before we consider issuing a PIN, we need to ensure that we're consulting. When we come up with a particular issue that you believe that there could be a contravention of the Health and Safety Act, we really need to go into and speak with someone with a person with management or responsibility workplace, perhaps a manager or a work site leader, and really really let them know what your concerns are. Really outline what the particular hazard are: who, what, when, where, how, why. We really want to sort of ensure that's elaborated on there, so the manager gets an understanding, or the person with management or control gets an understanding what's happened. Because sometimes what happens is that under the Work Health and Safety Act, PCBUs or any party do have can request a review of a provisional improvement notice. And sometimes where we've seen PINs fall down is they haven't consulted with the PCBU. So it's really important that you do go out there, that if you've got these issues, you raise it with your workplace manager. As again, you go who, what, when, where, how, why, and give them an opportunity to give some feedback and perhaps correct that issue. Now, a question that I might get, that I often get, is how long do we need to get that? And that would be dependent on the issue and the consequence and the likelihood. And going back to our earlier question, when you're doing that, understand that consequence and likelihood, look at those resources, your codes of practices, your Australian standards, reach out to your colleagues, your subject matter experts, and have a look there. Once you've done that consultation and given opportunity, you still believe that there's a reason to issue a PIN. There's a couple of technical things that I suppose make again, I'm not a big fan of good PIN, but make a PIN that's going to most likely stand up, I suppose. Ensure that the contravention is affecting your work group. Ensure that it is that the correct PCBU is listed. Ensure that the correct person with management and controls is. Look, these are a lot of technical things. One of the ones that we find people at HSR have difficulty with is the legislation, is which part of the legislation has been breached. And again, if you're not sure, have a look at the WHS Act. Again, those resources, the Code of Practice, the Comcare website. Look, what I'd recommend is have one of the key aspects of the legislation is Section 19, primary duty of care. Have a look at that. And whilst, again, I don't want to say, be an expert on the Act, but have an understanding of it, have an understanding what's there. The next part is clearly articulate what the contravention is. So I know it's got a brief definition, and sometimes that's clearly articulate and briefly describe, sometimes conflict, but you want to go back to what, the who, what, when, where, how, why. What is this hazard? What is this risk? Where is it occurring? When's it occurring? Who's it affected? And what is the breach of the Health and Safety Act? And then finally, control measures. It's not mandatory that you suggest control measures, but again, control measures, going back to what we said earlier about ensuring, and actually we're going to talk a little bit, I believe, a little bit later about what's reasonably practicable. And I'll talk more about reasonably practicable in a minute, but ensuring any control measure that you suggest is reasonably practicable.
Well, unfortunately, Mark, not enough time to talk about reasonably practical. We might have to hold that one over to next time.
Sure.
So, yeah, we've basically come to time on the forum. So I wanted to say thanks to all of our presenters and everyone online for your participation. It's been fantastic to have you on board. I really hope that you found the conversation this afternoon really interesting and valuable, with lots of insights, opportunities and challenges to reflect on. Just one more reminder that the recording of the forum will be available on our webpage in the coming weeks. And we'll put the link in the chat now link in the chat now to our website. So if you want to grab some of those resources or connect to some of the bits, we've thrown some links in as we've been gone. Just another reminder that the recording will be available on our webpage in the coming days. We'll put the link in the chat now for the website, as I said. Before you go, it's worth mentioning that we've talked quite a bit about psychosocial hazards today. It's important also to reflect on some of the latent physical hazards that many of us increasingly face, such as static postures and sedentary work. Comcare's been working with Be Upstanding team at the University of Queensland on a program that aims to help workers sit less, move more and improve their longer term health. They've just finalised an infographic on the results of that Be Upstanding pilot, which we'll share in the resources and links that are available after the forum when the recording comes out. Look, lastly, I want to say how important your feedback is. It shapes the content and the format of these events, and it influences the themes, the topics and the questions that we respond to. So that short evaluation survey will be sent, but the link is there. There's a QR code that you can jump onto, and I'd really encourage you to open it and respond to it right now. Honestly, it should only take about a minute of your time to complete. So be sure to tell us what you want more of, what the topics of interest are, and if there's an expert you'd like to hear from, etc. Thanks again for joining us. Have a great day and stay safe.
Thank you, everyone. Bye.
Thank you, everyone.
Thanks, everyone.
Good on you.